Hello everyone, welcome to my YouTube channel Baraka Nursing Studio. In this video, we will be discussing about Downey score, its importance and clinical application. Let's start with introduction. Downey score is a clinical assessment tool to evaluate the severity of respiratory distress in term newborns. It is a simple yet effective method that can help healthcare providers determine the need for further intervention or treatment. Let's go back a bit into the history of Downey score. Downey score was developed in the 1970s by Dr. William Downey, a pediatrician at the University of California, San Francisco. Dr. Downey recognized the need for a simple, reliable tool that could be used at the bedside to help healthcare providers determine the appropriate level of respiratory support for the newborns. The score was initially published in the Journal of Pediatrics in 1977 and has since become widely used tool in neonatal intensive care units around the world. Hence, this is a reliable and accurate way to assess respiratory distress in term babies. Downey score has 5 components, namely respiratory rate, chest wall retractions, cyanosis, air entry, and grunting. We will discuss these components one by one. The first component is the respiratory rate. Respiratory rate is the number of breaths a person takes per minute. That means it is measured in breaths per minute. The second component is the chest wall retractions. It is the inward pulling of the chest wall during breathing, often seen as intercostal or subcostal retractions. Then comes the cyanosis. It is the bluish discoloration of the skin or mucous membrane due to inadequate oxygenation. Followed by air entry. It is the quality of the air entry into the lungs assessed by auscultation. And the last component is the grunting, which is a harsh expiratory sound made to increase the airway pressure. Now let's understand the scoring criteria for Downey score. The score falls between 0 to 10, 0 being the minimum and 10 being the maximum score. Lower score represents less risk, whereas higher score represents more risk. We need to understand this. Higher the score, higher the risk of the respiratory distress. Now let's understand the Downey score table. It can be remembered by the mnemonic GRACE R, where G stands for grunting, R stands for respiratory rate, A stands for air entry, C for cyanosis, and R for chest retractions. For every component, score of 0, 1, or 2 will be given depending upon the condition of the baby. The first component that we have is the respiratory rate. If the newborn's respiratory rate is below 60 breaths per minute, score 0 will be given. If the respiratory rate falls between 60 to 80 breaths per minute, score 1 will be given. And if the respiratory rate is more than 80 breaths per minute, score of 2 will be given to that newborn. Coming to the retractions, if there are no chest retractions observed or seen, score 0 will be given. If mild chest retractions are observed, score 1 will be given. If severe chest retractions like subcostal or intercostal retractions are observed, score 2 will be given. Then comes cyanosis. If the newborn is acyanotic or there are no signs of cyanosis observed, score 0 will be given. If cyanosis, whether central or peripheral, gets relieved by administering oxygen, score 1 will be given. If cyanosis is present and is not relieved by administering oxygen, score 2 will be given to that baby. Next component is the air entry. If the newborn is having good bilateral air entry, score 0 will be given. If there is a mild decrease in air entry, score 1 will be given. And if there is a marked decrease in air entry, score 2 will be given to that newborn. The last component is the grunting. If no grunting is observed, score 0 will be given. If grunting is audible by using stethoscope, score 1 will be given. And if grunting is audible with ear, score 2 will be given to that newborn. Now let's understand the Downey score interpretation. The sum total of all the score gives the total number of score a newborn attains. The score of 0 to 3 suggests the newborn is having no or mild respiratory distress. Score between 4 to 7 represents moderate respiratory distress, and the score between 8 to 10 represents severe respiratory distress with impending respiratory failure. Now let's understand the treatment regime for the baby with respiratory distress. If the Downey score falls between 0 to 3, this means that the newborn is having mild or no respiratory distress. This means the newborn requires continuous vitals monitoring. Also, sometimes may require oxygen therapy. If the score falls between 4 to 7, this suggests that the newborn is having moderate respiratory distress. This level of distress may require more aggressive interventions such as CPAP, that is, continuous positive airway pressure. And if the score falls between 7 to 10, this means that the newborn is having severe respiratory distress or impending respiratory failure. So in this case, immediate resuscitative measures like intubation and mechanical ventilation will be required to provide adequate respiratory support. Also, continuous monitoring of vital signs including heart rate, respiratory rate, oxygen saturation, blood pressure, and arterial blood gas monitoring may be required. As we have learned about the Downey score, its components, let's learn the application of Downey score with a scenario-based example. We are given with a scenario which states that a 2-day-old baby born at term with a birth weight of 2.8 kg is brought with complaints of difficulty in breathing and inability to feed at the breast. The present weight is 2.65 kg. On assessing the vital signs, temperature is 36 degrees Celsius, respiratory rate is 96 breaths per minute, and oxygen saturation is 92%. The newborn is presented with the following symptoms, such as moderate chest retractions, grunting heard by stethoscope, decreased air entry on auscultation, and is also presented with nasal flaring and central cyanosis. Now, how will you score the baby or identify the risk for respiratory distress in this newborn using Downey score? As per the scenario, the respiratory rate given is 96 breaths per minute. That means the newborn is having tachypnea. What about the chest retractions? They are moderate. And about the cyanosis, the newborn is having central cyanosis. About the air entry, it is mildly decreased on auscultation. And about grunting, the grunting is heard by stethoscope. As per the scenario, the respiratory rate given is 96 breaths per minute. That means the newborn is having tachypnea. Looking into the table, the newborn will be getting a score of 2. Talking about the chest retractions, in the scenario, it is given that the newborn is having moderate retractions. So, looking into the table, the newborn will be getting a score of 1. Talking about the cyanosis, the newborn is having central cyanosis which is relieved on oxygen in the scenario. So, looking at the table, the newborn will be getting a score of 1. Now, what about the air entry? In the scenario, it states that the newborn is having mild decrease in the air entry when auscultated. So, in the table, the score 1 will be given to the newborn. What about the grunting? In the scenario, grunting is heard by stethoscope. So, as per the current table, the newborn will be getting a score of 1. When all the components of Downey's score are summed up, newborn comes up with a score of 6. So, a Downey score of 6 indicates that the newborn is in moderate distress and may require immediate medical attention. After learning the application of Downey score, let's understand the importance of Downey score. It helps in the early detection of the risk of respiratory failure among newborns or infants. It also helps in the severity assessment. That means it provides a quantitative measure of the severity of respiratory distress. Also, it helps in the treatment guidance. That is, it aids in determining the appropriate level of respiratory support, such as oxygen therapy or mechanical ventilation. And also, it helps in the monitoring of the progress. That means it can be used to track the effectiveness of treatment or the intervention being provided. In this video, we learned about the Downey score, its importance, and clinical application. So, Downey score is a clinical assessment tool for newborn respiratory distress that offers a rapid and accessible evaluation in settings where more sophisticated diagnostic tools may be limited. While it provides valuable insights into the severity of respiratory compromise, it should be used in conjunction with other clinical factors and diagnostic tests, such as blood gas analysis and pulse oximetry, to ensure comprehensive assessment and appropriate management of newborn respiratory distress. So, this was all about the video. Thanks for watching.